Hi, it's Ron Vender reporting live from the World Congress of Dermatology 2023 in Singapore. I wanted to review a poster that I found interesting, actually two posters. The first part of the poster is looking at deucravacitinib, which you know is a TYK2 inhibitor approved under the name of TYK2 for moderate to severe psoriasis. And this is a poster by Mark Lebwall as well as Melinda Gooderham. And this is an extension of the Poetic 1 study design and looking at the important part of the long-term efficacy at approximately 6 months, but also looking at the mean percent from baseline of PASI scores. And compared to apremilast, over 24 weeks, which is approximately 6 months, deucravacitinib has a mean reduction of PASI of about 76%, whereas apremilast is only about 50%. So that's important. Also, the mean percent change from baseline of the PASI score to 1 year. Now, this is 1 year of data long-term with TYK2 is again 76%, the mean percent change. So on average, your patient should have a 76% reduction of their PASI score, which is a reduction of redness, thickness, and scale. In addition to this, we can look at absolute PASI, which is a new way of looking at things just to see how much residual PASI is there. And by week 16, the majority of patients, almost 65% of the patients have a PASI of less than 5. And if you look at 6 months, then that goes up to about 66% of the patients will have a PASI score less than 5. Now, what about at a year? What happens at a year? What about that? It's about, again, 66%, showing that by 6 months, you're going to see the efficacy of deucravacitinib, an oral TYK2 inhibitor known as TYK2, that is taken once daily with or without food. It does not need any blood monitoring either, and showing a 66% chance of having a PASI, absolute PASI less than 5, and about 45% of having an absolute PASI of less than 2. So I hope that you enjoyed this poster. I'm going to review on the next segment the safety of deucravacitinib from the same study long term. So with that, this is Ron Vender saying so long for now from the World Congress of Dermatology 2023 in Singapore.